And I would like first to thank Dr. Istvan Gyuricsó for the kind invitation to be here. It is a pleasure for us, and we were very excited when we received the invitation because it is an opportunity to be closer to the countries and to have, conversations on a very important topic. A harm that nobody talks about, but yet it's still there, and it's very, very proeminent. So we are really grateful for this, and I'll start my presentation just to walking you through the agenda. So I'll talk a little bit about alcohol. Again, is this an ordinary product? Why is it that we need to do something in terms of decreasing alcohol consumption? How do we do this? What would be the so-called best buys, and how do we bring the evidence into action, and how do we change the culture, given that this is very proeminent? So let me start with, alcohol, and let me start, actually today, we just saw in the New York Times that the deaths by alcohol consumption in the US have more than doubled in a very short period. And what we see is, it's that alcohol is a substance that it's toxic. It's a dependence-producing substance, and it causes more than 200 diseases and health conditions and injuries. So we do not talk about the harms that it causes. We many times see in society, the use of alcohol as being something which is an ordinary product. So we do not hear people talking about the conditions and the harms that it causes. But if we would look at, those conditions that are causally linked to alcohol consumption, we know that many of these would disappear if there would be no consumption of alcohol. And more, we know that 1 in every 11th death is linked to alcohol in our region. And more worryingly, that these deaths occur many times early in life, which is contrary to what happens with tobacco. We see that, every fourth death in very young people between 20 years and 24 years old is related to alcohol consumption. So again, it affects the whole body. It's responsible for many cancers. It's responsible for many diseases, as I mentioned. And it also affects a lot the reach of the SDG goals. It is adversely affecting around 13 of the 17 UN SDG goals. And yet, it's out there everywhere. But let me just reemphasize that, as you can see, such a deadly product, it's not an ordinary commodity. It is a harmful substance, and as such, it needs to be duly regulated like any other toxic cancerogenic substances that we have out there. So it is really not a non-ordinary product that needs to be heavily regulated, and unfortunately, it's not. So we hold many records on yet we do not, talk about it, and many times we do not use the opportunities that are available to support women, when they start thinking about, pregnancy, for example. And we also have the highest contribution of alcohol to all-cause mortality, meaning that, the role of alcohol in our region is extremely, extremely important in terms of the mortality and the morbidity that it causes. Where do we stand in terms? So I just told you, we consume a lot. Out of the 10 countries, out of the top 10 countries in the world with the highest drinking levels, 8 are in the EU. So you see, we are the top consumers, and this is a little bit, where every country stands. And as you will see here, let me just see if I can advance. Hungary, it's although below the average of the EU, it is still, very high consumption country. And again, the harms that come with consumption are very high, and it doesn't change, with the type of measures that you can see in countries. So why do we need to decrease alcohol consumption in the world, and in particular in the region? Well, because first, it's harmful, and second, because we have environments where alcohol is everywhere. And this is, again, a reflection of, if alcohol is everywhere, it means, many times that it's too cheap, it's too available, it's too heavily promoted. So basically what we see is a huge normalization of alcohol consumption, including among young people, and it results on, highest consumption. And this is why, if it's everywhere, so cheap, so available, so heavily promoted, we are, without surprise, the ones that consume more in the world. So environments that we call alcoholic make it very difficult to recognize and to admit, for people to admit that they are experiencing harms from drinking alcohol, because it gets highly stigmatized. So if you live in a world where alcohol is everywhere, the fact that you do not drink, you are perceived as having a problem, maybe they have a problem, maybe she's sick, or whatever. So this is one of the big problems that we face in a very normalized alcohol environment. And not only that, it is because if it is stigmatized, then it will be very difficult for people to reach out for help, and also for people to recover, because again, the focus is put on the individual. It's like the individual has a problem, and we take away from the environment, which is actually what shapes the behavior. We take it away from the structural factors. And this is what the industry does by normalizing, by putting the risk into the individuals, and by saying, oh, people don't drink responsibly, in a responsible way. So they individualize it, when the fact is that we know that the environments shape our behaviors, and as such, we need to take, another type of approach, a public health approach, where we have different types of interventions that put, the alcohol consumption where it needs to be, and frame it, as a harmful product. So how do we do that? Basically, WHO has put forward what we call the WHO best buys, and these WHO best buys are basically 3. These are evidence-based policies that have an impact, and they are in the increase of taxes, restriction of availability, and restriction on alcohol marketing. So these are those policies that can really shape and change and challenge the environment, and that allows us to treat alcohol as a non-ordinary commodity. In Europe, we have a guiding framework. It was adopted by 53 member states that basically concentrate on what would be the 6 key areas if we are going to change alcohol harms, that would be more important for countries to focus on. And you'll see that 3 of those areas are the 3 best buys. So it's very much at the core of the framework, but we have additional 3 other areas which are about, health information, in particular, the role of alcohol labeling, so that people are aware of the harms that alcohol causes, given that it's not an ordinary commodity, as I mentioned, the health system's response, and also the community action, which is very important if we want to get support at the populational level for policies that, not necessarily are understood by the population overall. Let me just pass a small video. Let's see if it works about our framework. So basically, this has been really a very comprehensive framework that was put in place by the member states. And the aim is really, to put at the forefront those best buys areas so that we can make gains, health gains, reduce mortality, increase life expectancy, but also, get the community support and the awareness which is needed in a region where awareness is so low because alcohol is so normalized and as so seen as being, only, about the good moments instead of really showing what is the harms that are associated with alcohol consumption. So how can we bring, we know that alcohol is very harmful, if we know that there are policies in place, how can we then, do more in terms of bringing the evidence into action? So this is what, again, we have been doing. It's leveraging the evidence that we produce, the data that we produce, and also, leveraging the opportunities that we have in establishing partnerships at the regional level, but also at the country level and at the local level. So we are working with all the stakeholders, with all the partners, and this is why we're so grateful to be here today, because this is about, making WHO European region safer, a safer place, a safer community, a safer pregnancy, a safer region where we can thrive, where we can have, better lives and well-being free from alcohol harms. So the documents that are here are very important documents that really bring the evidence about what is the situation in the region, what are the policies that work, and how we could go about reducing the harms. But also, this project that has been launched, this is we call it Evid Action, basically the WHO project that brings evidence into action. And the project aims at bridging the gap between evidence and the policies that we know that work, again, focusing on a very important link, which is alcohol and cancer. And these are a little bit, if we look at the policies implemented in Hungary, you can see that we have a lot of empty cases there. So meaning that those policies that work, those policies that should be in place to protect from alcohol harms, and as I mentioned, it needs to be well regulated, they're not there. So alcohol is not well regulated in Hungary, and this results on increased consumption and again, low awareness of alcohol harms, because again, if you do not regulate a substance, this means that it can be out there and people do not necessarily understand, again, what are the harms? Because if you do not regulate it, it's because it's not important. So it all comes together, and that's why any policy needs to be comprehensive and needs to really, take in consideration that there are policy measures that are very important, both at the population level, so those 3 best buys, regulating the marketing, regulating the availability, regulating the price, but also other policies like interventions at the health system level or at the community level. So this is a little bit about the evidence. And if you want to know, if I would be in a country where I would put in place those policies, those WHO policies, those best buys, what would happen? Here are again, bringing evidence into action. This is a critical example of a country that has put in place those policies that work. So what happens? What has been the impact of putting these policies in place? And you will see here that we did an analysis, what happened when you start restricting availability or when you increase availability. So what is the impact in terms of alcohol consumption, or what is the impact, in terms of life expectancy? Because alcohol has this feature, which is, we know that by being a non-ordinary commodity, what it means is that it is a very harmful product that has an impact in mortality, has an impact in morbidity, but has also an impact in life expectancy. And we know that when we put these measures in place, we immediately see changes in life expectancy because we reduce mortality, right? So here you can see, and if you are interested, please, download these lessons from the Baltic Alcohol Control Policy Project, which basically looked at what happens when you implement those policies, and what is the impact in alcohol consumption, and what is the impact in mortality and life expectancy. So the effects on alcohol are, when you put in place those alcohol policies, are immediate. Contrary to tobacco, that takes years so that you can see the impact because it's a long-term shot. We talk about cancer. For alcohol, the effect is immediately seen in decrease of mortality. So it is really, very compelling evidence that when you put those policies, you immediately get the results that you are looking for. And again, this is very important, when we talk to politicians, if alcohol policies that work are implemented, life expectancy goes up, deaths from all causes go down, and we can see immediately the gains that we get in the country. So can we change this culture around alcohol that we have in place? Yes, you may remember that we talked about alcoholic environments at the start of my presentation, where, we can change the narrative, and we can change, the way alcohol is perceived if we have everyone on board. This cannot be done only by WHO. And again, this is why we're so happy to be with you, because this is everyone's role, everyone's task. Everyone needs to be on board, from international organizations to civil society to community to individuals. And as part of the Avid Action Project, we've been developing networks for this same region, for this very reason. We cannot do it alone. We need to have more people on board. We need people to disrupt the existing narratives and reduce harm from alcohol. So this is our youth network, and they're especially active in projects that we are developing, such as the labeling project. This is about labeling research. This is about putting labeling on the bottle because we know it works, because we have seen and we've been supporting by these young youth network and by the early career researchers network on collecting evidence that it does work, it does have an impact, and it is needed. And we're also very excited to collaborate, with the different networks, and with you in particular with this campaign in Hungary. So part of changing the culture is changing the narrative, which is so important for alcohol in countries. So we're so happy that we're doing this with you. And again, something we've been communicating about in recent years is the link between alcohol and cancer, because alcohol is cancerogenic. But again, if I tell you this was done in 1988, take a look, 1988, HuMSIRC was already producing a monograph that really established the causality, and saying that alcohol is cancerogenic. It was the same time as tobacco. Yet for alcohol, this has not made effect. Later on, they produced another monograph establishing very clear risks on alcohol and its cancerogenic effect. And again, it's out there, the evidence is out there. But we have sufficient evidence to say that alcohol causes 7 specific types of cancer. Again, the majority of the alcohol goes through the body, and it is through all the parts that it passes in the body where it causes the cancer. And this includes also breast cancer, extremely important for women. And while the evidence for alcohol and cancer is not new, we still haven't been able to, to put it out there. So what we have sought through together with Alexandra, that is here with me, is okay. So maybe we need to think through how we communicate about these risks, because the evidence is not new. And therefore, we've been doing more to translate the science into understandable language. We've been showing the urgency of this challenge in Europe, since cancer is now the leading cause of death due to alcohol in Europe. And again, showing that this problem is bigger than addiction, is bigger than just those, who do not know how to drink, that, have a harmful pattern, because cancer risk starts at a very low level. We just published a paper that is very clear. One single drink is enough to increase your risk of developing cancer, in particular, breast cancer for women. By changing the way we communicate about this evidence, we hope to increase the awareness, and we hope to increase the understanding that alcohol is not an ordinary commodity and therefore should be regulated. So again, more on communication, we have launched the communications campaign called Redefining Alcohol, and this raises awareness and promotes literacy about alcohol and the cancer risk by illustrating different voices and stories from people, highlighting the benefits of reducing alcohol consumption. And, sorry, it started too early. And inviting people to reflect, not necessarily drastic change in their consumption, but reflecting about how they are consuming alcohol, and should they have and redefine a new relationship with alcohol given the evidence that is now available. So it's really an invitation to rethink, to redefine. And again, we hope that this campaign in Hungary has been impactful, and we are looking forward to see all in your activities and events. So I will end with this video from our campaign. Very important aspects that are raised here. First of all, the fact that we need pre and postgraduate training, bringing this evidence to healthcare providers, because this is not being passed sufficiently during that training, but at the same time, the important role that have healthcare professionals and future health professionals in informing and empowering people with evidence-based information. So this is something that you are doing too, and this is very powerful, and we look forward to engaging with you. And just to end, if you have not yet signed up to our newsletter, please sign it up here. You'll have a lot of information about what we are doing, about major publications that we have released. And I can just say that when we talk about debunking myth, for example, we just launched a very important tool called the Alcohol Playbook. And this Alcohol Playbook is basically about how we go about industry arguments, because industry frames arguments, frames reality in one way, which is not based on evidence. So how do we go about demystifying those frames that industry brings, which are not evidence-based, and how do we frame it from a public health perspective? Because again, this is very important when we're talking about people in our daily lives that are exposed to these arguments that come from the marketing that they are exposed to, from the conversations that they are exposed to. So please, again, if you have not joined our newsletter, just do it. Thank you. Thank you very much. And I'll stop sharing.
Thank you, Carina, for the amazing presentation. I think it was really informative, and now we know a lot more about the policies that WHO is trying to make the change with. And now I would like to open the discussion. So if any of our participants have any questions, now is the time to ask. I think I will start with one question, and then I will give the place for the others. So you mentioned that in Hungary, alcohol is not really well regulated. What can we do to make it better? So what did the Baltic states did that they reached this increase in life expectancy? What can we medical students do? What can doctors do? What can, for example, WHO do, for example? So what is your opinion on that? I think you're muted now.
Okay. What I've shown you there, it's part of a tool that WHO created, which basically looks at what are the policies that are in place. So this is, the regulations, that you have in place to regulate alcohol, how available, what happens in terms of availability? Do you have policy measures that reduce availability? Like, for example, reducing the times, days of the week that alcohol is sold, for example, or reducing the hours that alcohol is sold, because we know this has a huge impact. For example, if you sell alcohol in petrol stations, we know that this has an impact because, again, you will consume alcohol, and of course, alcohol and drink driving, we know the impact that it causes in terms of injuries. So these are very important policies that need to be in place. And again, the evidence is very clear. How do you support that? First of all, by raising the awareness that this product is not an ordinary commodity. And again, providing information as medical doctors is extremely important, increasing this health literacy, as you just saw in the video. It's about starting the conversation, and it's about, this recognition that alcohol has an impact, a harmful impact in lives, and it starts at a very low level. This only is a huge game changer in the conversation, because what we hear out there it's again, those myths that, alcohol is good for your health. It's not good for your health. We know that even for cardiovascular diseases, alcohol is responsible for a huge mortality linked to hypertension, for example. And most people do not know, and they continue to say, no, it's good. So the risks from consuming alcohol outweigh any eventual small effect that alcohol could have in, cardiovascular because cardiovascular diseases are a huge package of diseases. Okay, so it is important to, first of all, address those myths. It is important to do it, and your role, at your level is in the health system, so that's very important. But it is also important, as I said, to start this conversation elsewhere. So, for example, you do not work only in the health services that are at primary health care level, for example. There's conversations that can be held at the workplaces as well. This is very important. We know that people spend a lot of time in the workplaces, and again, it's a place where we can start these conversations more. We can, and one of the important points also is it's to be more engaged as a community, community of healthcare practitioners, more engaged in supporting the policies that many times need to be put in place. So being more active. You saw social media. I mean, you're also good you were born in this, right? So,
Yes.
Using social media, using, all the opportunities that are available to, again, ask people to rethink, to redefine, the way they engage with alcohol. And mostly, to talk about alcohol as a harmful substance, like we talk about tobacco, because the evidence is very clear. So we should start changing the narrative around alcohol, because the risk starts at a very low level. By doing this, you will be supporting people to rethink about their relation with alcohol and the role that alcohol has in their lives. So I think this will be a very important step forward.
Yes, thank you very much. So now I would like to open the discussion for the others. Yeah, Eva has one question, so please go ahead, Eva.
Hi, Carina. Hi, everyone. Thank you so much for this fantastic presentation. And I think that it is such an amazing approach that you started this year in the communication. Just to introduce myself, maybe for the others, Carina, we were in contact. I am the communication officer for the WHO the country office in Hungary. And I really like the communication materials, this redefining alcohol. You can see real persons to talk about their alcohol consumption and how it defined they had to redefine the thinking about the alcohol. So I have, of course, many questions, but I don't want to stop the time and give the floor to the others. I think it's important, but I have only one question. So I see people who suffer from alcohol consumption around me. In Hungary, it's not rare, since we know the level of the alcohol consumption is very high in Hungary. So in the world, I think we are now the first on the list. Do you think that is it a personal problem? Or do you think that it is a problem of a society or a smaller community, and we all are responsible for it? This is my question. Thank you.
Okay, thank you. So I would like to say two things. First of all, I talked about stigma, and stigma is a major barrier for people to talk about alcohol consumption. Okay, so as you said, you see around you, and many times people are around us, and they have, again, they many times what I've seen in my practice is that people feel ashamed or even don't even question about their relationship with alcohol. So many times even we can see that there is a problem and people will not talk about it. Or many times people see that there is a problem and they don't want to talk about it because you just think it's going to disappear. Maybe it was only one day, things like this. So first of all, the stigma really has an impact in how people talk about their consumption. And this is very unfortunate because we see that a lot of these people would benefit from the start of a conversation that would help them to redefine their relationship with alcohol, and they don't step forward because they are afraid that they're going to be judged. So as a society, we need to be better in destigmatizing alcohol consumption. And you said, is this an individual problem or a societal problem? So first of all, alcohol is a substance that produces, it's a substance that impacts in your brain. It's a drug. It's a drug. It produces effects in your brain. It's a psychoactive substance, like many other drugs. And I see there's a question here in the chat. Why is it that we consume alcohol? Well, because it works, right? I mean, everybody knows if you drink, one glass, you feel one way. If you drink two, you feel another way. If you drink three, you feel, another way, right? So we consume it because it works. It has an effect. And it has an effect in our behavior and how we feel because it's a drug, right? Society has decided to take it out of, there was a time when alcohol was also restricted. But what we see with other drugs like cannabis as well, it's a move of society, to kind of liberalize, to put it out there in the society. So this is what was done with alcohol. But we cannot forget that it's a psychoactive substance. So it causes dependence. It causes, harms that, it's not just about dependence. It is about changing the behavior and harmful behaviors. Risky behaviors because it's a drug, right? And it is out there in the society. And then you were saying, is this an individual problem, a societal problem? Well, we know that if a drug is widely available in the society, people are going to use it. That's why, you have drugs and, it's because it works, right? So if you, for example, legalize a substance, which is, again, a psychoactive substance, more people will be consuming that. But if you have an industry around it, then it amplifies the potential for consumption. This is what happened with tobacco. Tobacco became a problem once there was an industry behind that created the cigarettes. Anyone that studied, the story of tobacco consumption and harms knows that tobacco was around for many years, but people could not really consume it because it was, really, not nice to consume. But once you had the industry behind that really created a product that made it easier for people to use that harmful product in a way that you don't feel, you just feel the effect, you get addicted, it feels good, another drug. So it became a wider problem. More people were consuming that substance, right? So put an industry behind and it creates what we call, the perfect storm, no regulation, everybody just being pushed for widely consuming because it becomes easier, because it becomes affordable, because it becomes, overall kind of an environment that is proactively inviting you to consume more. So I would say, to you and to the person in the chat, we as a society these alcohologenic environments have an impact in the way we perceive alcohol and in the way we perceive, if we talk about other environments where we perceive the role of the substances, just think about tobacco. So when I was born in a generation where everybody was smoking around me, and for me, it was not a harmful product. But then when, the law started being in place and we had all this evidence, then, suddenly it changed my perception. And it had a very important role in the consumption of people around me, right? So this is what we're saying about alcohol. We need to change the perception. So it is also a societal problem because we don't have the right perception.
Thank you very much for answering the question. That's what I wanted to read to you next. But we also have a few more there. We'll see how we'll be on time, but I would like to read the first one if no one else has a question now in their mind to talk about. So, do you think is there a possible risk when cutting down the amount of alcohol, people will just buy cheaper ones on the same amount, which means lower quality also?
There's a lot of evidence on this. First of all, if you increase taxation, you do not see people overall going to cheaper products. Where you would see this happening is, at a social lower level, where people are already consuming very cheap alcohol, that the tendency would be that, they continue to consume very cheap alcohol, right? So basically what I would say is if you increase taxes, you do not see people going to shifting their patterns of use to cheaper alcohol beverages. Those who consume cheaper are people usually with very harmful patterns of consumption, and they would stay in that type of pattern, but not necessarily you would see the other changing. So what we see when you increase taxation is that people basically, reduce their alcohol consumption. They do not go for cheaper products.
Thank you. And we have one more question in the chat. So, why do you think that in very young ages alcohol is very prevalent today, especially in Hungary? It's a really huge problem that they start to drink on a really young age.
Yeah, I mean, this is very worrying because basically this is exactly linked to the environment. If the environment is conducive to drinking, then this is what, you will see people doing from a very young age. And I mentioned the example of tobacco. The environment plays a very important role. So I showed you that in Hungary, alcohol is not at all regulated in terms of the marketing, in terms of its availability, in terms of the prices. So this has an impact in the fact that it's widely available. It's there, it's out there, and you have an environment where everybody is going to consume. So it incentivizes the consumption. It's called, alcohologenic environments, as I was mentioning. So if you are growing in an alcohologenic environment where alcohol is not seen as a harmful substance, where it's cheap, where it's everywhere, where, you will follow the trend. So this is why it's so important to put in place those policies that work, regulate it as a harmful substance, and support people in increasing their health literacy as well. This will make the changes needed.
Thank you very much. Does anyone has any more questions left? So we have.
I think there's one here on the labeling. Yeah, so labeling is very important. I mean, when we talk, you say, do you mean something like the ones on tobacco? Well, we mean that harmful products need to be labeled. I think you would agree with me. If this is a carcinogenic substance, we need to label it. Yet, what we have been doing is looking at what would be the best way to label a substance where there's so low awareness of the risks. Okay, so how would people react? What would be the better way of doing this in a way that would result in the change of behavior rather than a reaction? Okay, so what we have seen, and we've done a study, Alexandra is here with me. I mean, she's been studying all of this, how do we communicate together with my team, a team that is also dedicated to the labeling part. What we have seen, one was that alcohol harms awareness is very low. And because it's very low, when we look at how labeling could look like, we have seen that we need to put those labels there in the bottle. Yes, done in a way where people perceive that there is a risk, but we would not, at this point, go for labels where you would see people with the cancers, like you see for tobacco today, okay? Because the awareness is not there. So we need to build, the awareness by putting those labels there, very prominent, with, occupying a huge part of the package as well, like we do for tobacco. Very clear information, very clear communication on the risks, but there's a way to go, and there's many options that could be used. So this is what we do in WHO to see, even if we have the evidence, what is the best way to inform, a policy like, labeling of alcoholic beverages. And we've published a paper, so you can also look at this. Yes, Alexander just put it on the website. Thank you, Alexander.
Thank you very much. Eva, I think we have time for more questions, so please go ahead.
If there is no other questions, I have, of course, I have several. Because it's such a big problem, and I think it's good to talk about it very honestly, that at the same time we see two kind of messages. One is from the alcohol industry, which is a very flourishing industry, that the alcohol is a kind of luxury in your life, and the good alcohol, so if you drink a very good wine, you belong to a group of the society where you want to belong to. The other hand, you see many conversation about the risk of the alcohol consumption, and these two messages just don't meet. So how can we help with it?
We just published what we call the alcohol playbook, where it is exactly what you're saying, Eva, and we're so happy to be working with the country office and with the Ministry of Health, because as you said, in our daily lives, we are confronted with two types of message, which is this one where everything is very glamorized, and as you said, the way we develop this relationship with alcohol is modeled, is basically driven by a very powerful marketing campaign from the industry that, without even noticing, changes our behavior and the way we perceive things, because we aspire. This is what marketing does, is, make you aspire, develop a relationship with the brand, with the product, where you just see yourself, oh, if I, as you were saying, if I drink, I'm part of that club, I see myself, in another environment. So this is why marketing is used, right? And this is why industry puts so many resources there. It's because it works. So we are led by these powerful industry groups shaping our behaviors. And many times when I hear people saying, oh, it's my decision, I just think, really? Are you aware of how much money is put? Do you think that people would put all these billions in marketing if it didn't work? you're not so free to decide because you are driven by a very powerful industry and by those arguments that look nice, but are not based on the evidence. So as you said, there's another message, which is a public health message. And this public health message is based on the evidence. Yet it's so difficult. And this is where we need to leverage. We need to leverage the opportunities. We need to really, be bolder in the way we address these harms using the public health argument, which are the evidence-based arguments. So Alexander just put it here in the chat, and you will see that, this playbook is really about those daily messages that we receive by the industry and the way that evidence states what are the real arguments of what industry is trying to feed us with, because again the evidence is very clear, and we just need to start using those evidence-based public health arguments to be able to counteract the industry arguments. So I invite you all to read it if you have not seen it yet, because this is where you will see those arguments. And again, we're very pleased to be working with you, Eva, and to be working with WHO at the country level, and to be working with the stakeholders. And it's fun. Again, it's so important to be working with you, because we have a lot of work to do. Hungary is a country where there's a lot of opportunities. Let's look at it as an opportunity to be bolder, to bring this conversation into something that will be powerful for the society, for the young people, which is do you really need alcohol in your life? Have you ever thought about the role it plays in your life, and again the harms that it causes? So a lot of resources that we produced, but again these resources are as good as the use that we are going to give it to them. And this is where we count on you to be able to, to leverage the potential that we have there. And Hungary is really a country where we would like to see further changes. Thank you.
Thank you so much for your reply. Thank you.
Thank you very much. And I think we are out of the time. And I would like to thank you again for accepting the invitation. And I think this was a really important topic to talk about today. And I also wanted to thank the participants that joined us today. And I hope you guys also enjoyed this event as much as I did. And I think now it's time to say goodbye. And I hope we meet again one time, maybe later. So thank you very much.
Thank you. Thank you very much. Bye-bye.
Goodbye.